Growing up in the streets of London, I've seen some pretty dark things. From stories of drug abuse and sexual violence to gang culture and suicide. Most of these issues remain a taboo within the Muslim community, but I want to explore these issues, how they affect Muslims, and what we can do to change them.
In 2016, 3,744 people died of drug poisoning, both from legal and illegal drugs. When it comes to drug-related deaths, 54% of them are related to opiate and opiate-based drugs like heroin and morphine and things like that. And would you believe, in this country, 750,000, that's 750,000 people every day use drugs. That's 250,000 people in active drug abuse every single day in the UK. Phenomenal. So I want to find out more about addiction. How does it affect people's lives? How do they get into drugs in the first place? And more importantly, we as Muslims, what can we do as a community to help those suffering from drug addiction? And finally, in turn, how can we stem the issue of stigma attached to the issue of drug addiction and help those who are afflicted by this illness?
While there aren't detailed statistics on drug addiction within the Muslim community, it's important to remember that being Muslim doesn't make us immune from drug abuse.
We're on our way to meet a friend of mine. He's kindly agreed to talk to us about his experiences. He's basically suffered from drug addiction most of his life, on and off. He's had periods of being clean, but unfortunately he's back in that situation where he's relapsed and he's living an active life of substance abuse. People always wonder, like, you know, is it just a moral issue? A lot of these people have good morals, but their morals then decline because they're so desperate. And in turn, what happens is that, you know, they start compromising principles and beliefs which they previously wouldn't have. For instance, they start doing criminal activity, whether it be stealing from family, whether it be shoplifting, and that's where the whole criminal element comes in. Yo, can you hear me?
I can now.
Alright, cool. We're just driving to you now, so we should be there in about 15-20 minutes left, yeah?
I arranged to meet a friend of mine under the condition of anonymity. He's been an active drug user for quite some time now and is currently addicted to heroin. We met in a suburban area of London where you wouldn't imagine that there were many drug addicts, but he told me that there were 3 drug dealers on this road alone.
What age were you when you first tried drugs?
Well, I believe it was probably about 14 years old when I first tried drugs. Being my friend's brother at the age of 15 when I reached my senior year in high school. My best friend's brother was about 19 years old. And he was a big heroin addict at the time. And when I was introduced to him, I remember going to central London with him, you know, on a trip. And my friend wasn't around. We went to central London, and yeah, that was the first time I used heroin. And
You got into drugs at quite an early age,
Sure.
you know, 14, 15 years old, high school. What do you think are the real reasons or the causes for why you got involved in drugs and eventually obviously live a life of a drug addict?
Well, I guess the main reason would be that, you know, you're 14 years old, you know, the way to steer someone away from drugs is obviously prevention. And obviously, in my situation, I believe that, you know, my guardians, my parent, you know, wasn't aware of, you know, didn't see the signs early enough. And also, you know, I was allowed to have idle time and not have your heroin on a daily basis. It puts you into withdrawals.
What does it feel like when you take it? What does it do for you?
I mean, it's hard to explain, but I guess there's a sense of euphoria when you take heroin. I mean, when I first took heroin, you know, I was largely curious. I didn't know what to expect. I guess you know, when you first start using, obviously, your tolerance builds up, and you end up needing more and more. So, you know, you're always chasing that high. But at the moment, I guess it's just, you know, at the moment I'm just taking it to basically because I need it because of the physical withdrawal.
Okay, so like, what's the worst it's ever been for you in terms of like a daily kind of drug consumption? Because I know obviously if you're working, it must be a lot more tempting to spend more money on drugs then, right?
I mean, I went through periods where I would spend easily 100 to 200 pounds a day. There was a time when it was recreational, where obviously it was fun using, and I was spending a lot more money. Whereas now, I kind of have to foresee my day, foresee my week, and kind of plan every day to make sure that I'm not withdrawing from the heroin. And unfortunately, I am unemployed. And I guess routine is like I wake up, whenever I wake up, and I guess my day is first about finding that fix.
How prevalent is this issue in the community?
But I'll be honest with you, there is quite a huge drug problem in the community, and again, it comes to unawareness. People are completely oblivious of this, but unfortunately, it is present. And this is one thing that I believe that one way to cause prevention, one way to tackle, one way to give support is obviously to educate parents into what's going on in order to see the signs early.
Everyone goes through ups and downs in their faith, right? Like, how much has it helped you?
Ultimately, I guess your conscience kicks in, or obviously the morals and values that religion teaches you. Obviously, it goes hand in hand, and it weighs on you, and obviously that we know that we'll be answerable, and that does weigh on my mind very heavily. I mean, I've gone through a period of sobriety for 10 years before, and I believe in that period religion did help me greatly.
Have you found any help in the Muslim community in terms of support, or how do you feel they treat drug addicts?
To be honest with you, I believe, as far as I can only speak on my community, and I believe my community are completely uneducated into drug issues and drug problems. And to be honest, there is no support. I would never think of going to my community to gain any kind of support. And obviously, I think it's largely because they do stereotype drug users, and that's purely because they're unaware and haven't been educated.
It became clear to me that my friend's drug addiction was less like a bad habit, but more like a disease that's controlling him. It was also clear to me that he felt that he had no support from Muslim institutions. This made me think about how we as the Muslim community should deal with the drug abuse crisis and what we can do to help.
I was just quite shocked at some of his responses in regards to the frequency of like drug use within like society generally, in terms of, like he said, it can affect anybody. It doesn't matter what background you're from, whether you're a professional or whether you're unemployed. And at the same time as that, even what he had mentioned about the area he lives in, because as I said, I was looking around and it's quite a nice residential area, part of West London. Yet he was saying that, there's 3 drug dealers just on that one strip. We've had the perspective of a drug addict, so now we want to get a professional's understanding. We want to go see a mental health professional who deals with drug addicts and alcohol addicts, and find out what her take is on the situation in regards to how can we help people who suffer from drug addiction going forward.
Dr. Razina Thaki is a qualified psychotherapist who has worked with many patients from all backgrounds. She helps her patients deal with their addiction issues through various therapy programs, including CBT, cognitive behavioral therapy, and 12 steps. Dr. Razina herself has treated many Muslims who are addicted to drugs and alcohol.
How widespread is the issue of substance abuse in your experience? And more specifically, how prevalent is it in the Muslim community then?
It's quite prevalent, and like I said, we see it as a secondary cause of depression or anxieties, and it's treated quite a lot in our practices. But I think we didn't have as much statistics about the Muslim community until now. Over the last 10 years, I can see lots of more Muslim patients from Muslim community that coming forward. I believe that it's a disease like any other disease that exists, and if someone has a heart attack or any diabetes or any other condition, then we would like to treat that, and we support these people. We don't put them in prison. We support them. We give the help they need instead of judging them about why they have what they have. We don't have much research about Muslim communities because people don't still come to us. So we need really to invest, more time to say linking with the mosques and with other representatives of Muslim faith to help the community to talk about that, not as a shame, but it's like, again, if we were coming forward and tackling the issues to prevent these things happening.
What do you see as the solution, I suppose, both for, as I say, society at large and more specifically the Muslim community, if we are to try and tackle and deal with this issue of drug addiction?
We need to come together and talk about this. It should start from families and schools, when we go to the mosque or everywhere. So I think that is the first thing that we need to do, because I find sometimes it's difficult to open up to go because we have the stigma attached, but also we try to protect our family members and we don't want to reveal anything what has happened in the families. I've seen the relationship failing because of this. I've seen people losing houses, and I've seen people not being able to support the children and children being taken away from them as well. And to support some of my clients, I've gone to the AA meetings with them, and I've seen the age, range was from very young to elderly person, and I saw that he had lost the house, he couldn't keep the house, and living on benefits. So it is quite detrimental.
Drug abuse and addiction are an unspoken vice within the Muslim community. Evidently, and sadly unsurprisingly, there's a lot of stigma and shame attached to the issue, not just for drug users, but for their family and friends too. Speaking with Dr. Razina made me realise that anyone can be affected.
So I guess the question that needs to be asked is, what is the solution? Well, from all that we've ascertained today, communication, I think, is the key. And that starts with our communities, our mosques itself. They need to be facilitating, supporting groups, workshops, any form of aid that we can give to those suffering from addiction. And in turn, if our mosques are then educated, our scholars will then be educated. We need to ensure that sheikhs and imams are approachable, that people suffering from the addiction will actually go to them for help. If that is not available, then how can we then expect them to turn towards faith in order to solve the issue? And then finally, we need to be educating our families. Parents need to know of the dangers that lie ahead. They need to know of the things to look out for. Otherwise, if we can't understand the issues at hand, we're never going to be able to cope with the symptoms and the problems that we're then having to deal with. So as I say, communication is the key. And if we're not facilitating those avenues for people to access, then basically there's no hope for the future.